my name is Francesca Russell. Today's date is Sunday, March the 9th, 2025. I will be showing my, back of that is just some bullet points of the content that we have covered in week 1. So diving right in, going through disease. Disease is considered the chronic or acute illness that develops either during the lifespan of a person or human, or can be at birth. So classifying diseases include the etiology, the clinical manifestations, the pathogenesis, the morphological changes, and the diagnosis of the clinical course throughout the disease. Going through the etiology is understanding, the root cause, whether that be like through biological agents like bacteria, viruses, also chemical agents, which could include radiation, physical forces, trauma, injury, and like the inheritance of genetics, so being born with it, just genetically predisposed for this disease, and then also some nutritional deficits and excesses. Going through the or the pathogenesis of a disease is really understanding the start to finish. So the timeline of the disease or the journey throughout. Going further is going through the signs and symptoms. So symptoms can be what the patient is complaining about. So say, for example, pain is all subjective. We can't visually see pain, but we can look at for signs. So signs is what the provider or the healthcare worker can note themselves and observe. So through their physical exam, vitals, things that we can see. Then there's syndrome, which is kind of a combination of the signs and symptoms, and that it could be, for example, like the chronic fatigue syndrome. Then going through diagnosing these diseases, it's pretty much getting to that endpoint or a destination of the health problem. So, for example, if a patient comes in with shortness of breath, we're noting and seeing signs of the patient's being short of breath as well. So providers can use diagnostic tests to rule out either whether this is pulmonary, for example, like a pulmonary embolism with a CT chest, or going towards, cardiac, heart failure kind of deal and ordering an echocardiogram. To see if there is any indication of heart failure there. Complications can happen with just the diseases or during treatment processes. So, for example, diverticulosis, you can have an acute diverticulitis, and a complication of diverticulitis can be a perforated bowel if waited too long. Or, during the treatment process, say they're getting an XLAP surgery and one of the mesenteric arteries are nicked. So that would be a huge complication to the treatment of the diverticulitis. And then going through the prognosis, so at the very pretty much understanding where this disease process will end, depending on kind of the experience of the provider, recent research, things that they can come together and kind of give the patient like, hey, this is something you can live for 5 years, or is this kind of a terminal, we have 6 months or less to live. So understanding all that is very important to understanding everything about the disease, and hopefully this will help anybody that's not in this course. Thank you for your time. Bye. All my content is cited by the Porter's Pathophysiology 9th edition by Sheila Grossman textbook. I have it right here. And of course, the fantastic Dr. Rodriguez with University of New England in his presentations. Thank you.